Welcome back to the YouTube channel, guys. What we're going to be discussing today is the most common knee problem that folks run into. We have here a knee model, a nice GPI anatomical model, which includes the bones, ligaments, tendons, as well as some of the muscle tissue. Let's go over some quick landmarks and familiarize ourselves with what we're going to be discussing. We have the upper bone, which is the thigh bone, the femur. We have the lower bone, which is the tibia. In between these bones is the menisci, the medial, the one towards the center, this being the right leg, this being towards the center, and then the lateral meniscus being more on the side. We have this little guy here, which is the fibula, which is the bone on the side of the leg, of the lower leg. Then we have the LCL, which is the lateral collateral ligament. It's a ligament that stabilizes the knee and prevents movement of the knee towards the middle. We have the same ligament on the opposite side called the MCL, medial collateral ligament, prevents movement in the opposite direction. We have some things in the back here. These are some muscles that were taken out in order for us to be able to view the ligaments. We have some of the ligaments here are the PCL, and we have the ACL, which is the most commonly torn. These ligaments primarily prevent rotational movement of the tibia, this bone, and femur of this bone, and that's how they tear when the foot is planted. So if somebody's a basketball player, they plant the foot, they rotate, and that's how the ACL tears. So what is the most common pathology of the knee joint? The most common pathology is called the patellofemoral joint syndrome. And what that is this here is the patella, it's the kneecap. And what happens is that the patella, the kneecap, is supposed to glide a particular way when the knee joint flexes and when it extends. When it flexes, it's supposed to slide down. When it extends, it's supposed to slide up. Underneath the patella is cartilage, soft tissue, similar to this, to the meniscus. And it helps it glide, kind of like a little ice skating ring for patella, which is the skate, in order for it to glide. What happens when the patella doesn't glide how it's supposed to glide is it starts to glide side to side a little more, and it can cause irritation underneath the kneecap itself. Then we can hear some crepitus, we can hear some noise. As the kneecap glides, more irritation occurs there. And then we don't want to bend our knee or extend our knee because that causes pain. So we just start to limp around with minimal movement in the knee joint. What is the cause? The most common, there's plenty of causes, but what is the most common cause of this problem? So let's look, in order to discuss that, at the muscles. So this is the thigh muscle, the quadriceps. Quadriceps, they are called because there's 4 of them. We have this guy, we have this one on the side, and then if we look at the view from the top, we have one underneath this guy here. So without getting into the names of each of these muscles, the most important thing that we have to remember is that this muscle here, which sits towards the middle of the thigh, is the most important muscle when it comes to stabilizing the kneecap, stabilizing the knee joint, and directing how the kneecap moves. This muscle, because it's visibly longer and it comes down lower than all the other muscles of the thigh, it has more of a relationship with the knee as well as the kneecap. There is a portion of this muscle, so it's not even the whole muscle, it's a portion of this muscle, which is called the VMO, the vastus lateralis obliquus, which is the most important muscle around the knee joint. This muscle tends to get weak quite fast if the thigh muscles are not exercised appropriately, and if there's any sort of instability or pain. When this muscle loses its strength and or musculoskeletal endurance, the amount of friction that goes on in the kneecap increases to a point where there begins to be irritation. Also, it doesn't stabilize the knee joint as it should. So, this is not the only cause of knee pain, but it's one of the most primary causes that we see in the clinic. I would say, unless somebody had a surgical procedure, such as a knee replacement or an ACL repair, 80% of knee pain is caused by a weakness in this muscle here. Okay? Guys, thank you very much for watching the video. Feel free to comment below if there's any questions, and tune in next week. We're going to be discussing common pathologies of the elbow. Thank you.